Hello, I'm Bill Connors from aphasiatoolbox.com, and this presentation today we're going to talk about pharmacology and aphasia treatment and recovery as part of our newsletter that comes from the Aphasia Center of Innovative Treatment. So let's make sure that we know this is not medical advice but rehabilitation-based information and opinion based on our experience, my experience, general knowledge, and how we have reviewed the fairly detailed literature on this subject. So, when we're talking about using medications to help people with aphasia maximize their recovery, I think we start with common sense. Make sure that the drugs and medication that the person is on right now make sense. Carefully review them with your medical team, your physician, and so on. Perhaps get some second opinions about the kinds of interactions and the medications that a person is taking. Secondly, of course, do no harm. Make sure that any medication you might want to try, be it bromocriptine or any of the other pharmacological agents that are out there for aphasia recovery, are not contraindicated for the kind of medications the client is on now or any medical conditions. So make sure you review that carefully with those important medical personnel who are involved. There is some controversy about whether supplements and vitamins can be in any way harmful, or are they just benign. Please be careful, again, to discuss with your healthcare professionals any supplements or over-the-counter medications that you are taking, especially relative to how they may interact with anything that you're going to add to the medication list. I know personally, I can't remember what I was taking, ginger or something, and it seemed to raise my blood pressure. So communicate well and often with your medical professionals. Remember, too, that the important thing is you're going to want to know if this is helping. Is this drug helping the person talk better or think better? It's very, very difficult, if not impossible, to definitively establish what's helping and what's not, especially if that person is in aphasia or is having spontaneous recovery. So it's impossible to tell definitively what is giving the benefit at any given time. So consider those issues. Now, you know, the professional and research-based studies that have reviewed pharmacology, Cochrane reports, and so on, they all seem to question the way the studies were set up as to whether they're really answering a research question. So make sure that we review all that sort of information with care and caution. You know, these results apply to a class of people or people in general. We need to consider that personal, independent, individual person when we're working on adding any medications. Now, my personal experience with my clients is that adding medication, the results are inconsistent. They're sort of vague. We're not sure if it helped or not. Most of my clients weren't sure if it helped. Some thought it did, but most gave up those efforts over time. I would say that there were some times when people seemed perhaps to improve their initiation or ability to get started when they were trying to talk or do tasks. We may have seen some things there. Overall, we really couldn't tell over the past 30-some years of our work. A recent article in the Journal of Physiology thought that there was some hope with some of the medications, of course, because so many good things are going on with pharmacology. But the studies to date just don't answer the questions the way they need to. This article indicated that it was very variable depending on the individual who was taking the medication. The medication seemed to work best combined with treatment, but then we don't know which is which. And bottom line, the results were just equivocal. We just really were, it was ambiguous as to whether the medications really helped, or did it help to a significant degree. I would say, of course, be sure that whatever you do, whatever you're doing with medications, is part of a whole person recovery program for that person recovering from aphasia. I'd refer you to our previous Aphasia Toolbox newsletters to talk about how important rest and sleep and exercise and nutrition are to maximize recovery. And finally, make sure that the speech therapy you are receiving is truly exploiting the person's neuroplasticity and the person's uniqueness. So remember, this was not a medical advice sort of thing. Rather, it was intended to discuss our knowledge of and history of and review some of the literature that's out there as you consider whether you want to try medication, adding medication to the program for the recovery of aphasia. So there are lots of pharmacological agents out there that have been tried with recovering aphasia and cognition and memory and so on. So for a more detailed report, we would be glad to send that to you. Just send us an email or visit our website, use the contact form, type Pharmacology and Aphasia Treatment and Recovery. Likewise, if you have any specific questions, feel free to forward them to us and we will answer your questions as soon as we're able, which usually doesn't take too long. All right, I'd like to thank Sharon Renhack for her wonderful work with our newsletters. Be sure to go to our website and sign up for our newsletter if you haven't been receiving it. And good luck with all of the efforts to help your person recover maximally from aphasia.